Hello, everyone. My name is Chen from Washington University in St. Louis. I want to take this great opportunity to talk about our work on developing focused ultrasound drug delivery technique for DIPG treatment. As we know, kids with DIPG have a survival rate of almost 0 and a median survival of only 9 months. We need innovative techniques to improve the treatment of this disease. However, there are two major challenges. One, the tumor is located at the brainstem, which regulates vital life functions such as breathing and heartbeat. Unlike many brain tumors, a DIPG tumor cannot be removed through surgery easily. Any invasive approach carries significant risk of causing neurological damage or even death. Second, DIPG often has an intact blood-brain barrier with reduced permeability when compared to other brain tumors. Focused ultrasound-induced blood-brain barrier disruption, or FAST-BBD, has been established as a promising technique for non-invasive and localized blood-brain barrier disruption. Several clinical studies have demonstrated the feasibility and the safety of this technique in enhancing the permeability of BB in adults with various brain diseases, including glioblastoma, Alzheimer's disease, Parkinson's disease, and ALS. However, few research has been performed on developing the FAST-BB technique for the treatment of pediatric brain cancer. So one of the objectives of our group's work is to optimize FAST-BBD for non-invasive, localized, and precise drug delivery to the brainstem with a long-term goal of translating this technique to the clinic for the treatment of kids with DIPG. We have established the feasibility of FAST-BBD in the delivery of nanoparticles to the brainstem of healthy mice in 2018. We have been advancing the integration of positron emission tomography or PET with FAST-BBD for the in vivo quantification of the spatial temporal distribution of radio-labeled agents delivered by FAST-BBD. Here shows the sagittal views of representative PET images of 2 mice without and with FAST treatment. They show that we achieved non-invasive and localized the delivery of the radio-labeled nanoparticle at exactly the focused ultrasound target brainstem area. And the quantification of the PET images verified that focused ultrasound significantly enhanced the delivery efficiency of the gold nanoparticles within the target region. Our team has established a genetic engineered mouse model of DIPG. On the contrast-enhanced T1 weighted MR images that you can see here, we don't see clear evidence of MR contrast agent leakage. In comparison, I'm showing the contrast-enhanced MR images of a mouse implanted with glioblastoma tumor. The bright color indicates leaky blood-brain barrier in a glioblastoma tumor. After verifying that the developed DIPG mouse model has a non-leaky BB, we then performed the FAST-BBD with the focused ultrasound targeted at the center of the tumor, which was followed by intravenous injection of copper-64 labeled gold nanoparticles. As shown by these representative PET images, we achieved successful delivery of the radio-labeled agents to the DIPG tumor. Currently, most of the clinical studies of FAST-BBD have been performed using the InsightTech MR-guided FAST system. In the past several decades, many studies have been performed to optimize the FAST parameters and the microbubble parameters for FAST-BBD using MR-guided FAST system. However, one key fundamental physical question has been overlooked is that whether the static magnetic field generated by the MR scanner affects the microbubble cavitation and the BB disruption outcome. We performed FAST-BBD in different static magnetic fields by placing the mice at different distance away from the ecocenter of MR scanner. The magnetic field strengths as measured by a Tesla meter were 4.7, 3, 1.5, and around 0 respectively in our study. All other experimental parameters were kept the same for all the mice, and we performed passive cavitation detection to monitor the microbubble cavitation activity during fast sonication. And after fast sonication, the BEB opening outcome at the brainstem was evaluated using contrast-enhanced MRI. As demonstrated by these representative images, contrast-enhanced MRI images, we achieved blood-brain barrier disruption precisely at the brainstem in all the mice that we treated. However, lower blood-brain barrier opening was achieved at a higher static magnetic field strength. Here are the quantification results of the BEB opening volume based on the contrast-enhanced MR images and the stable cavitation dose for mice sonicated at different static magnetic field strengths. The BEB opening volume and the cavitation dose both decreased as the magnetic field strength increased, which suggests that the static magnetic field acts as an additional ambient pressure that may dampen the microbubble oscillation. If we want to avoid the damping effect of the magnetic field, fast BVD should be performed outside the magnetic field. When performing fast BVD procedure outside the magnetic scanner, we will need an imaging technique that can monitor the fast treatment and assess the treatment outcome. We developed passive cavitation imaging, or PCI, for the real-time monitoring of microbubble activity during fast sonication of the mouse brainstem to assess whether the cavitation activity imaged by PCI can be used to predict fast BED drug delivery outcome. We performed a study to evaluate the correlation between PCI and the PET. Here shows how the study was performed. An ultrasound imaging probe was confocally aligned with a Fox ultrasound transducer. When the intravenously injected microbubbles reach the Fox ultrasound target brainstem, the microbubbles are activated by Fox ultrasound to emit acoustic signals that were passively detected by the ultrasound imaging system to form images of microbubble cavitation. Right after fast treatment, the radio-labeled gold nanoparticles were injected to the mice, and then the mice were scanned by a PET CT scanner. The PCI and the PET were registered by identifying the common anatomic features of the skull in the ultrasound beam mode images and the CT images. Here are the representative images from 3 mice treated by a fast BED using exactly the same protocol. The first column is PCI overlaid on beam mode. Second column is PET and the CT images. The third column is overlay of PCI on the PET CT images. We can see there were strong spatial correlation between PCI and the PET. We evaluate the pixel-by-pixel correlation between PCI and the PET within the brain using a segmented linear curve fitting. We found that a good linear correlation exists between PCI and the PET, indicating that PCI can predict concentration of delivered agents at the pixel-by-pixel level. This finding suggests that passive cavitation imaging can spatially paint the delivered agent concentration, a technique that we named as cavitation dose painting. The concept is like paint by numbers, which uses passive cavitation imaging to control precise delivery of a certain amount of drugs to an exact location in the brainstem. To conclude, fast BED can achieve non-invasive, localized, and precise drug delivery to the brainstem with great promise to be applied in clinical treatment of DIPG. I would like to thank my team and our collaborator on this project. Thank you for your attention.